Hi, this is Ian Bostock, and this is my reflection for week 5 of my clinical internship. This week, we've been doing a lot at football. We've gotten a lot busier in the AT room, especially going around with some injuries we've had come up. And it's just been, we're getting ready to go into the season, so during camp weeks, we've been really busy. It's been early mornings into the afternoon, so yeah, had a lot of stuff going on this week. For my internship goals, it seems like we've been reaching a lot of steps. I seem like I've got to do a lot more evals, upper and lower, working with a lot of patients, getting to see a lot of things that I may not have got to see last week due to just getting to know people, getting to do some smaller things rather than the bigger things now. Been working with a lot of patients. I've got to know a lot of more people, which is one of my goals. I want to get to know all the people on the team, get to know people in the facilities, so I've really got to reach that goal as well. I feel like that's something that I've really got to go hands-on with, meet some more coaches. I've met a lot more players. And then finally, just with the knowledge of special tests, I feel like I've kind of got to do some things, not a lot, but I still would continue to like to get into those. Just doing those on patients, hands-on, getting to work with athletes in certain ways and see what's they've got wrong with them. It's really helped me reach that goal in different aspects. Week 1 expectations for this internship. Like I said in my last reflection, I felt like there were a lot of things I kind of felt were going to happen. Football, I know, is a stressful time. It's a stressful sport at times. It can get hectic. There's a lot of athletes in and out. And you see that in the clinic, especially right after practices and during treatment time. There's a lot of people that are in there, in and out, just to get some small things. Some of them just want ice. Other ones just want some Normatec, some recovery. They're just tired. A lot of them are just sore. And that's, I mean, I expected that with football. There were some things that were unexpected. Just the amount of time it takes to set stuff up. You don't realize all that goes into setting things up until you have to do it yourself. And, you know, getting there early and you're working your butt off to get things set up in time and then go straight into taping ankles and getting people ready for practice. It's a lot of work. I didn't really expect that going in, but now I know it. And it's really taught, I guess it's giving me that organizational skill. It's time management skill that I think I lack sometimes as a student. This week, I've seen a lot of patients, a lot of different athletes. We have a receiver who's coming in with some knee issues. I've been working with him a little bit, trying to get him, I guess, to 100%. He's had some knee problems these last couple, I guess, months, even years for him. He said that football is the knee problems, but he's been coming in. We've been doing some icing. Or we've been doing some ice cup stuff on him. We've been doing Normatec, just trying to get some flush, Graston on him. We've discussed using some topical creams just to get on there and maybe help some inflammation he's got there. Just things like that. Just some different things have been helping, kind of talking to my preceptors about different things we can do for him. I've also had a patient that just recently came in with some hamstring issues. He's kind of been dealing with it as best he can, decided it was kind of getting to the point where he can't do it anymore by himself. He came to us, and he's a younger guy, so he was just kind of, he did not 100% on some things. We've been doing some strengthening stuff. He's got getting some strength back, getting a lot more strength than what he had. He's been doing some recovery stuff, just some Normatec, stretching, ice, things along those lines. He's saying he's feeling a lot better, and I've been talking to my preceptors about him as well, just trying to work with him. I feel like I've had a lot of discussions, and for me at times I feel like I'm being, I guess, talked down to. I'm a person that kind of takes things hard sometimes. If it's more of an educational thing, I feel like sometimes I get talked down to, and I know I'm not, but I've had a lot of discussions with my preceptors, and sometimes they just come in and they're doing things. I feel like I'm not doing it right, and they're trying to tell me that, but I understand it's just trying to learn. It's an educational thing for me. Sometimes I feel like I'm just being told I'm wrong, but I know it's an educational thing. I've had a lot of discussions with preceptors these last couple days with some grass and techniques, and then a couple, Shelly in the office has been coming out and helping us and showing us different things that she's learned and different aspects of things we need to look at when we're evaluating a patient, rather than looking at one area and looking at other areas and seeing that there may be something around the kinetic chain that is also hurt, also injured, and we have to look at both of those or look at that as well. Really looking forward to next week. I'm hoping to get some more experience in the clinic with more patients rather than just, normal tech recovery things. I've been working with a lot of patients hands-on now, trying to get some exercises in, trying to get some therapeutic stuff for them as well. I'm hoping to get some more of that next week. Honestly, I'm just looking forward to getting ready for the regular season. First game's coming up in about 2 weeks, so I'm ready to start that, see how stuff goes during regular season rather than preseason with camps. I'm hoping to see just see how it goes and get ready for everything going on.